Welcome back. Now, this week we have been chronicling the life and choices of a woman with breast cancer. For more on that, we turn now to Africa 54's Ndimyake Mwakalyelye. Ndimi.
Well, thank you, Vincent. When actress Angelina Jolie announced that she had both breasts removed to reduce her chances of getting breast cancer or double mastectomy, she raised the issue of preventive surgery. Now, genetic tests had shown that the actress had an increased risk for both breast and ovarian cancer. VOA's Pearson has been keeping up with former VOA reporter Zulima Palacio, who has cancer in one breast but decided to have both breasts removed.
Zulima Palacio spends as much time as she can these days at her pottery wheel.
Pottery has been my mind and physical therapy for 15 years. It's extremely relaxing, it's very creative, and again, it's something that takes your mind from something difficult.
Palacio was diagnosed with breast cancer in March, has been through chemotherapy, and now has decided to have both breasts removed, even though her cancer is only in her left breast.
I personally have decided to have a double mastectomy. The reasons are many.
Among them, the chance that the cancer will come back.
The idea of spending the rest of my life with a Russian roulette, and thinking at what time this thing is going to go bad, it's not for me. It's not for me.
It's also called the Angelina Jolie effect, since the actress had a double mastectomy after genetic testing showed she had a high risk for both breast and ovarian cancers. The idea of preventative surgery is a controversial one. Dr. Marc Boisvert at MedStar Washington Hospital doesn't recommend it.
I think education of everyone is important here, because I think you can get peace of mind knowing that you're being monitored very carefully and knowing what the numbers are, what the chance of recurrence, for instance, are.
Overall, she's tolerating treatment fairly well.
Palacio's doctors say a double mastectomy isn't necessary.
I know.
But nurses and other breast cancer patients told her to go ahead with it.
Okay. I have 3 friends that had one mastectomy, and 2 or 3 years later, cancer came on the other side, and they had to have the second mastectomy. They said that is a very hard experience. They all told me, Zuli, go for the double mastectomy now and don't wait.
Despite differences of opinion, most doctors agree that a patient must be comfortable with her care, whether it involves careful monitoring, aggressive treatment, or surgery. Pearson, VOA News.
Well, joining us now in the studio is Zulima Palacio herself. And Zulia, I must say thank you so much for coming in.
Thank you for having me.
Like all our audience, I've been getting to know you through the series that Pearson did so expertly. And now that I'm seeing you, it's just such an honor. And wow, what an epitome of strength you are.
It's a journey. You discover you have the strength when you need it. I didn't know I was that strong. But when you need it, you need it, and it's there.
Well, you look great. How
Thank you.
long have you been going through treatment and post-treatment?
I was diagnosed in March
of this year.
And I had chemotherapy for like 6 months or so, 5 months, and that was misery.
Yes.
Whomever said chemotherapy is difficult has no idea. Chemotherapy is really hard. And then after that, they give you a little bit of break, and then I have the first surgery. I still have 1 surgery to go. Okay. So I had the first surgery with double mastectomy, and it's practiced by 2 doctors. So the general doctor that takes all the wrong stuff out, and then a plastic surgeon that comes and puts a prosthesis to start giving you breast again, so that you will stretch the skin and create breast again.
So how did you feel about making the decision to have both breasts removed, yet there was only one really affected?
It was not easy. But number one, I had 2 or 3 friends that had the same as me, had one side removed, And then 1 or 2 years later, the cancer came back on the other side. That put a red alert. I don't want to go through this again because the experience is very difficult to go through it again. But also, I always thought that if I ever had cancer, it would be on the right side. I had had a couple of biopsies. It was always like I couldn't have any caffeine because then my breast would get full of bumps and things. And then I said, you know, it's a hard decision, but I'm going to take it because I have the feeling that it's just a matter of time for my right side to have it.
Did it make you feel any less of a woman?
Oh,
a lot
gosh,
of people
no.
say that sometimes a lot of women don't want to even have their breasts cut off because it takes away a sense of your femininity.
I hope I am not a woman just because of my boobs. I am a woman for many more things than that. I hope that at least the man that is with me and that I care for loves me. He says, I love you with or without them. So that is fine.
That's a wonderful support system to have.
But
we've been seeing.
I got a great support system.
Right.
And friends and family and my husband. It has been a wonderful, an incredible journey, yes.
So I'm curious about what made you, I know that you and Carol Pearson are very good friends, so that made, you know, less difficult, but your decision to share your story, considering, you know, how difficult it is.
We talk a lot about it. Carol and I are very close friends. And we talk a lot about it, and she convinced me about the fact that around the world, many women have to go through this quietly. Many women around the world think that they are a damaged good and they are not good anymore because they had a mastectomy. And I said, oh God, that sounds awful. If we can help one woman with this television series, I will be happy. If one woman says, I didn't do anything wrong, I was very healthy, I was very active, there is no cancer in my family, I didn't do anything wrong to have it, and I got it. I think it's environmental. Of course, I was an environmental writer for 15 years, and I think that all the pollution, the water we are drinking that is not all that clean, the air that is polluted, the fruits and the vegetables we are eating loaded with chemicals, I think that is causing this epidemic with people that didn't do anything wrong. I didn't do anything wrong.
Right. I was going to ask you that in terms of, you know, you did everything right. Is there anything you think you could have done different?
No, no.
Because
I am totally into sports. I'm totally into organic food and environmental issues. There is no cancer in my family. Nothing. It took me completely by surprise.
So what would you tell somebody who has either just been diagnosed with cancer or is going through treatment in terms of, you know, getting a little bit of the strength that you have?
I think that the strength came from a lot of friends and family. Don't take it alone. You don't have to take it alone. Grab all the good energy and all the good positive friendships. You know, I think that positive attitude has a lot to do with fast and better healing. I think that the support is very important. I decided that you can either cry for the rest of your days or you can fight back and tell all your friends, if you want to cry, go to the bathroom, do your crying, come back, make me laugh, be with me, give me all your positive energy because I need it. And guess what? It worked.
Do you have a sense of fear of mortality?
Not really. I see mortality as a fact of life, but it is a very interesting experience to face death face to face. It's a very interesting experience.
Well, I wore this scarf for breast cancer.
Very pretty.
We just wish you continued strength. Any final words?
Yes. If I can help, again, any woman with this and say, you know, look for help. You are not a damaged good. You are better than ever. And you can still live a full life, full of joy with those that love you. And those don't love you just because of your boobs. They love you because you are you.
Absolutely. Well, what an honor. Thank you so much for sharing your story and coming with us on this journey. That's Zulima Palacio. And she's a former VOA employee who underwent treatment for breast cancer. And it was all documented by Carol Pearson, another reporter here at VOA. And that's our Africa Health Network report for today. Please be sure for more health news and developments to visit our website, africahealthnetwork.com.